Welcome and thank you for joining us today. My guest is Dr. Al Edwards, Principal Advisor for Government Programs for Delta Dental in California. Dr. Al, thank you so much for being here.
It's a great pleasure. Thanks for having me. I look forward to it. This is going to be a lot of fun for us.
Absolutely. So I want to start off by talking a little bit about dental insurance. Dental insurance seems to be something that people might overlook when they're choosing their benefits during open season. So from your perspective, why would that be a bad idea?
Well, I think more people are seeing the great value that dental insurance provides. And here's an interesting data point from a recent survey. Our parent company, Delta Dental Plans Association, conducted a third-party survey this year, and 86% of adults and parents of kids under age 12 believed that dental insurance is essential to protecting oral health and overall health. Now, that's a stunning statistic, I think. So folks are making that connection between a healthy mouth and a healthy body, and dental insurance can help them achieve both. I also want to speak about the connection between oral health and overall health. There's a great number of research articles out now that associate serious medical conditions with gum disease. And that research has shown a strong link between gum disease and many medical conditions: diabetes, heart disease, stroke, pneumonia, adverse pregnancy outcomes, and even dementia. And let's not forget that regular dental visits can help with early diagnosis and treatment of oral cancers. Now, I also want to stress that dental insurance is cost effective for folks. Delta Dental's FedVIP plans provide preventive dental services at no cost to the patient twice a year if they visit a dentist in our network. And if you get your checkups and your cleanings every year, you save much more than the cost of the annual premiums you pay. And our plans also control the cost for more expensive dental treatments such as crowns and root canals.
Now, thank you, Dr. Al. I also understand that you don't only work for Delta Dental, but you're also a dentist yourself. I think that might be clear to our audience already, but can you talk a little bit or maybe give some examples of the connection there? So the link between oral health and general health. What are some of the things that you've been able to discover in your practice?
Yeah, well, so I was a military dentist. I was in the Air Force for 21 years and retired in 2005. And I, over my career, I was able to see a lot of different things. And one of the cases, I'll probably go over two cases, but one of the cases that was really interesting to me was when I was in the United Kingdom at a Royal Air Force base. And we had a young teenage girl. She was 13 or 14, I think. Her mother brought her in because she had a lot of bleeding of her gums, pretty much all over her mouth. The gums were swollen, they were red, they just looked really angry. So we got her in, we taught her really good oral hygiene. We gave her those instructions, worked with her very carefully, and we got her in for several appointments to clean up her mouth, to clean her teeth, make sure we could do the best job we could do with her. She came in about a month later just for a follow-up, and honestly, things didn't look much better. So back in my mind, I'm thinking, okay, so we've done what we can do. Her hygiene had improved a lot, but she still had this problem, and it was affecting her social interactions with her friends. And so this was not a good situation. So back in my mind, I'm thinking, okay, this is something else. It could be a systemic disease. It could be a blood disorder like some of the cancers like leukemias, or it could be diabetes, right? Juvenile diabetes. And so we sent her over to her primary care physician. They did a full evaluation and with all the blood testing and all the other things that they do. And lo and behold, she had juvenile diabetes. They got her on a good regimen of insulin, and we got her back a couple months later, and things looked tremendously better. So that's one case that I vividly recall. The other one was also in the UK, and this says nothing about the UK, but it just so happened that's where I was. But We had a patient that came in and to see us, and he had had a significant medical problem about 2 months prior. He had developed a brain abscess. When they did the surgery in a UK hospital, the neurosurgeons, they cultured the abscess material, and it came out that the causative bacterium had been in the oral cavity. It was a common bacterium in the oral cavity. So this is a patient who ultimately developed a brain abscess from a bacterium in the mouth. So 2 cases there, pretty significant, I would say. But it shows a direct link between a healthy mouth and a healthy body.
Right. I mean, you gave those two examples, but just more generally, how often do you see something like that happen where the diagnosis or understanding there might be some other underlying condition comes from just maybe a routine exam there?
Yeah, periodontal disease or gum disease is the primary cause of systemic health conditions. And so, you know, we try to treat that as best we can, and we do a good job with that to get patients healthy. But we know that, the chronic inflammation, the toxicity from the oral bacteria in the mouth can enter the bloodstream and cause a bacteremia. They can also go down through the lungs, through the oral pharynx, and through the GI system. It can cause things like gastric distress or inflammatory bowel disease and things like that. So we're always aware of things like that as we're looking at a patient. And what I would say is that a lot of times the cases that I brought up, they were unusual, okay, rare. What I would say more commonly, we're able to pick up uncontrolled hypertension or high blood pressure in patients, and occasionally, things such as possible congestive heart failure. When you're doing your evaluation of the patient, you're kind of looking them over, the head and neck. If you can see their legs and their ankles, swelling of the legs and ankles suggests, okay, there's something going on there, and it might not be controlled. So you want to do a referral to a physician. So things like that are more common that we see in a dental practice. The other cases that I talked about, while rare and they're sort of cool to talk about, they don't happen very often. I think even more commonly than those 2 rare cases I talked about is being able to spot and diagnose an oral cancer or suspect an oral cancer and then have a biopsy done for a complete diagnosis.
And Dr. Al, can you tell me a little bit more about the presence that Delta Dental has in local communities and your relationships with other organizations?
Wow, I'm so glad you asked that. We have a Delta Dental Community Care Foundation in Delta Dental, California, and our affiliates, and it's our philanthropic arm. We do a lot of work with nonprofit partners to increase access to oral health care. We fund oral health education and support organizations that serve other vital community needs. Since 2011, we've donated over $150 million to improve oral health in communities around the country. And I want to tell you about a cool program to address poor oral health among older adults, senior citizens. We've begun a $5 million partnership with Howard University College of Dentistry and Mary Center right here in the District of Columbia. And what they do is provide dental treatment, and they've helped over 4,000 low-income and senior DC residents. The patients come in not only for cleaning and exam, but they also get a treatment plan, and most of them have been able to complete those treatment plans, resulting in vastly improved oral health, a return to their social activities, enjoying a nutritious diet again, and just basically overall improved quality of life. We also are very active in the veterans community. As a veteran myself, I'm very, very proud of what Delta Dental does. We're the largest provider of dental benefits for veterans, and we're a proud partner of Disabled American Veterans. We also have a really a good relationship that we've developed with the American Heart Association, and I want to tell you a little bit more about that. Heart disease is the leading cause of death in the United States, and we're working with the American Heart Association to educate everyone about the connection between oral and systemic health, which you've heard me talk a lot about today. And we'll be developing new ways to detect and prevent heart disease in dental practices. Now, I don't know how this is going to look. We're still working on this between us and the American Heart Association. But I can tell you, I think this is going to be a game changer for dental practices in the years to come.
Right. So just having that in mind, this, understanding this connection between oral health and just overall health for someone, what would be something that you would say, or what would be your recommendations to either federal employees or military retirees who might be thinking about dental insurance options during open season this year?
Uh, Great question. I think maybe three things. You want to enroll with a company with long-term experience. You want a company that's really laser focused on oral health and not a lot of other things. And you want a company with a large provider network that provides timely access to care. Let's talk about experience. Delta Dental goes all the way back to 1955, when a group of dentists from California, Oregon, and Washington states that got together to form what was really the first dental insurance program for employees. And this whole idea spread to other states. And in 1966, the Delta Dental Plans Association formed. Today, there are 39 independent Delta Dental companies in the association. My company, Delta Dental California, is the largest one in the association. But what I will tell you is that all 39 of us have vast experience doing this stuff. We are in business to improve oral health. We work hard every day to help patients get the right oral health care at the right time and in the right place. Oh, no, by the way, at a cost that they can afford. I mentioned oral health focus and how important that is at Delta Dental. We've been focused on doing this, on improving oral health for almost 70 years, all the way back in 1955, like I said. We have vast experience to get our patients the best affordable care in the largest provider network in the industry. And we have thousands of dedicated dentists in our network whose aim is to keep their patients healthy. Let me give you a neat fact, Drew. 89 cents out of every dollar we take in from premiums goes to provide oral health care. I don't know, can other companies say that? Our patients can be assured that we are putting most of their premium dollars back into improving their oral health. And you might say that we're putting our patients' money where their mouths are. Okay, I'm sorry, I had to say that. That was corny. I apologize.
No, no, go ahead. Was there something else you wanted to add there?
Yeah, let's talk about networks, because that's really where it gets important here. Because if you don't have a good network, a large network, an accessible network, then your patients can't get the care they need. So we have 31 million people that trust Delta Dental California and our affiliates for their dental coverage, and that makes us one of the largest dental insurance providers in the nation. You've heard me say that we have the largest network of dentists in the nation. We own our network. It's not leased. And Drew, this is an important point to remember. We don't have leased networks. And when dental insurance companies lease networks from other carriers, they have less control over cost and also less control over the quality of care that's provided. And I think that's a very important distinction to make. Since I am very passionate about quality of care, it's a big deal with me. I want to get into that a little bit more with you, because we contract directly with the dentist in our network. We can monitor the quality in each dental practice. In fact, we conduct 2,000 to 3,000 in-office audits every year to check for things like office cleanliness, instrument sterilization. Oh, by the way, that's key. Infection control procedures, that's key. and records management. How are they documenting the treatment they're providing for their patients and our patients? It takes a lot of resources to do this work, but we do it because it's important to our patients that we give them the highest quality dental health care, oral health care that we can. And finally, I got to tell you, this is an important distinction point also. We were the first dental insurance carrier to have our provider credentialing process certified by the National Committee on Quality Assurance. That's a big deal. We re-credential our providers every 3 years, and it's a very rigorous process. Why is that important? It's important because we need to verify their licensure. Is it still current with the state they're practicing in? We need to verify if there's any adverse information in the National Practitioner Data Bank. There are all these other things that we look at. How much continuing education have they had? So this is a huge deal. It's a big discriminator, and it's one of the things that I'm very proud that we do. And we were just recertified this year.
Well, your passion for this work certainly shines through, Dr. Al. Thank you so much. It's been great talking to you today, hearing more about oral health and the connection to overall health, hearing more about the importance of dental insurance. I'll certainly be scheduling my next checkup, but thank you so much for joining me today. I appreciate it.
Thank you very much. It was a pleasure.
Dr. Al Edwards is the Principal Advisor for Government Programs for Delta Dental of California, and I'm reporter Drew Friedman. You're watching Federal News Network. Now let me send you back to the studio for more on the Open Season Exchange.